Hello, my name is Steven Ujansky, LMSW. I'm a therapist here at the Serenity Center, and today I want to talk to you about one of the things that we treat here day to day, specifically the issue of addiction. Today we're going to talk about what addiction is, what it is not, how in the clinical world we diagnose it, and how we define it. To begin, I'm going to read to you the definition of addiction by the American Society of Addiction Medicine. Addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and individuals' life experiences. So to take this apart a little bit, addiction, much like diabetes, is a chronic condition. Usually, once a person becomes an addict, there is no going back. Once you become a pickle, you could never go back to being a cucumber. It's a lifelong struggle. But just like diabetes, which could be managed with proper medication, exercise, and better lifestyle choices, addiction could be helped with therapy, participation in 12-step fellowships, sometimes when needed proper medication, and other kinds of interventions and supports. It's a medical disease. It's not a character flaw. It's not a moral deficiency. Just like a person with high blood pressure would not be embarrassed of having high blood pressure, a person who struggles with addiction should not be embarrassed of being an addict. It's a medical condition which requires professional help, and they should always seek the help that they need. Addiction is a complex issue. It's not just genetic, it's not just environmental, it's not just caused by trauma. It's all of those things that come together in different combinations for different people. You could have two people who go through the same experiences and use the same amounts of drugs, alcohol, and one of them becomes an addict or an alcoholic and one does not. Addiction is not limited to substances. It's not just drugs or alcohol. It could be to a behavior like sex, like eating, shopping, or gambling. Addiction is quite complex, and it always requires professional intervention in order for a person to get better. How do I know? I'm an addict in recovery, and today, many moons later, I am a therapist who helps others deal with addiction. And things have gotten better for me. And believe me, they can get better for you or your loved one. Now, how do we diagnose addiction? Well, to begin with, I'm going to read to you 11 criteria from the DSM-5, which is the guide for all mental health professionals that defines mental health disorders or psychiatric disturbances, as we sometimes call them. There are 11 qualifiers. They all apply to a person who struggles with addiction. Not all of them at once, and sometimes in different order and priority hierarchy, but most of them are present by the time that the case gets to us. Number one is taking the substance in larger amounts than intended. You only want to have one shot, but you end up having 5. And you wonder how did that happen. Number two is wanting to cut down, but not being able to. Every time you do it is the last time, but then there always comes the next time. Number three is spending a lot of time getting, using, or recovering from the use of substances or a behavior. And that is something that every addict is familiar with. It just overtakes your life, and that's all you do. Number four is having cravings and urges, just like a lady who's expecting might be craving something. It's an overwhelming sensation, just wanting something right now. Most people who struggle with addiction can understand what that is. Number five is not being able to fulfill your responsibilities. Number six is continuing to use even if it causes problems with your relationships. Number 7 is giving up important social or recreational activities because of substance use. So like playing sports and doing things that you once enjoyed, you just don't want to do them anymore because now all you want to do is just be alone with your drug of choice or that behavior that you're addicted to. And we say in the clinical world that the opposite of addiction is connection, because addiction is isolation. All addicts isolate, and it's a pretty lonely condition. Number 8 is using substances again and again, even if it puts you in danger, because simply not using appears to be a riskier ordeal than using in some crazy, dangerous circumstance. Number 9 is continuing to use even though you have a physical or psychological issue which your addiction makes worse. Some people could be literally allergic to that drug, or their mental health can suffer from that particular habit that their addiction it represents, and they will continue doing it knowing that what they're doing is insane. But as Einstein said, insanity is the repetition of the same mistake while expecting different results, and we always expect different results. Now the next two, that number 10 and number 11, are pretty important because once those come around, that's when you know you're really in trouble. Number 10 is needing more of the substance to get the effect that you want every time. So if one pill was enough in the beginning, now all of a sudden you need 2, and then you need 3, and now you need 4 just to achieve the same effect. It just doesn't work anymore. That happens because our brain is designed to maintain homeostasis, which means our body is always in balance. And once you take a substance that either slows it down or speeds it up, the brain reacts by doing the opposite. And now, to achieve the same result, you need more of the same substance. And number 11 is a direct result of number 10. It's experiencing withdrawal symptoms once the substance is no longer present. So an alcoholic might have the shakes. People who are addicted to opiates experience withdrawal, acute withdrawal for the first 7 to 10 days after the cessation of substance use. And that could be quite debilitating. The way that we classify addiction is if a person has 2 or 3 of these symptoms, it's considered mild. 5 or 4, it's considered moderate. 6 or more, it's considered severe. And unfortunately, by the time most people come into treatment, their problem is quite severe, just because addiction is so misleading to the addict that they come to realize that the problem exists once the problem is quite severe. The good news is that one of the main criteria which defines whether a person will get better or not is how motivated a person is to change. And usually the more consequences there are, the worse somebody off is, or the closer someone is to hitting their rock bottom, the more eager and willing and open-minded they will be to receive the treatment that they need and to get the help that they need and to really commit to making a difference and getting their life together. I hope that if this applies to you in any way, that you will pick up that phone and give us a call. Again, my name is Shlomi Uzansky, LMSW, with the Serenity Center, and I hope you have an amazing day and wishing you all well. Good night.